all of my colleagues. I've been listening with interest and glad to add a few words of my own on the subject of Bill 141, entitled the Health Protection and Promotion Amendment Act 2010. This is the first thing I would observe is that this is about as simple a title as you can get from this Liberal government in terms of entitling bills. I'm surprised they didn't call it "We really did a great job, but think we could probably do a better one next time around in case there's a pandemic that doesn't materialize, Act 2010. But that's what it seems to be. The first thing that I want to recall is what happened a year and a half ago for all of us in our ridings, for all of us in our homes. There is probably not a member in this legislature who didn't hear from constituents during the course of the fall of 2009 because of one problem or another that materialized in that time period pertaining to H1N1. A lot of people with a lot of trepidation, mothers and fathers of children, older people, people in affected groups or more affected groups being very concerned with what would happen if they didn't get the vaccine in time, because this was certainly a sky-is-falling scenario. And just so that we make this clear, I'm not making light of this in using that kind of terminology. This was a legitimate fear, and I think one in which we all shared. But if you search your memory and you think about what was happening, the complaints took forms of examples like this. There's not enough vaccine at this particular spot and there are lineups around the block. Or we have too much vaccine and there's not enough of a lineup and the vaccine has to be destroyed after a certain period of time. So that it seemed to be a mismatch in a lot of areas in terms of quantities of vaccine, quality of vaccine, the ability to administer the vaccine, conditions in the venues that were selected to administer the vaccine, and who was going to get it when. And that's before you get into the issue of people who were jumping queues. And we all heard reports of that on radio, television, and in the newspaper. That's what was going on a year and a half ago. And that suggests to me that all of the things that could have been done weren't done. And that's in a situation where there never really was a pandemic that materialized. I found it interesting that the choice of words, as signified by my friend from Lanark, and as used by my friend from Guelph, don't match the situation in every sense. I think that's what my friend from Lanark wanted to signify. For example, the member from Guelph kept referring to this as a pandemic. I'm not sure, Speaker, that this indeed was a pandemic. It was an apprehended pandemic. We feared that there might be a pandemic or an epidemic, but there wasn't. Again, not making light of it, thank God there wasn't. But it wasn't a pandemic, so what we're looking at in this bill is planning for something that could one day eventuate, and that we all hope won't. The Ontario Progressive Conservative Caucus identified a number of problems with the rollout of the H1N1 response back in the fall of 2009, and I have touched on a few of those in the past couple of minutes. The management of the H1N1 outbreak was well coordinated internationally. From the World Health Organization, we watched those nightly reports on television of people talking to us from Geneva about what was going on in the world on the question of H1N1. The federal government also was acknowledged to have done a good job. The biggest problem was in the distribution of the vaccine at the provincial level here in Ontario, where it was clear that there wasn't really any central oversight over the 36 public health units in Ontario, and that seems to be what this bill in large part wants to address. Problems were identified by the Chief Medical Officer of Health in her June 2010 report entitled The H1N1 Pandemic, there's that word again, How Ontario Fared. So again, this bill is largely a response to Dr. King's report. The Health Protection and Promotion Act, or HPPA, is to be amended by this bill to require that the Minister of Health and Chief Medical Officer of Health approve any appointments of acting medical officers of health for a term of 6 months or more. This would be under pandemic or apprehended pandemic circumstances. Secondly, the proposed act would amend the HPPA to allow the minister to make an order for the possession of publicly owned premises or part of a publicly owned premise for public health purposes. And that's defined as an inoculation facility. What's being said there is, under certain circumstances that we could loosely describe as an emergency, the Chief Medical Officer of Health gets more extraordinary powers than ordinarily would be granted. And this kind of power is taken if the Chief Medical Officer of Health is of the opinion that there is an immediate risk of an outbreak of a communicable disease or to the health of persons in Ontario. And finally, this proposed act would amend the HPPA to allow that the Chief Medical Officer of Health could issue a directive to any Board of Health or Medical Officer of Health requiring the adoption or implementation of certain policies or measures in the event of or an immediate risk of a provincial, national, or international public health event, a pandemic, or an emergency which health impacts in Ontario, and the policies or measures are necessary to support a coordinated response. That's a lot of fairly legal jargon. What it says is, if something like H1N1 is believed to be in the process of materializing in our area, then the Chief Medical Officer of Health has powers to do what needs to be done to address the public health in those circumstances. Now, the first thing that I should say is that our caucus will be supporting this bill. There's nothing here that is of such detail or attention that we find any need to go against it. There are a number of challenges and concerns with the bill, however, and the first thing that I would like to cite was mentioned today in the presentation of another bill by one of our critics, and this happened to our critic, the member from Whitby, when this bill was presented. And I'm quoting from Ms. Elliott in Hansard upon presentation of the bill, where she says, "Unfortunately, as has become the norm here, I am responding to a piece of legislation that has just now been delivered to me, so I'm a little bit short on details." We heard that again today. So I might, without deviating too much from the substance of the bill, say to the Liberal government, if you want to present bills, particularly ones like this where you have a legitimate reason to believe that we won't argue too much with you and we'll actually support them, could you please give us the details of that bill before the fact so we can give you an adequate response? That was housekeeping. But mainly in response to Dr. King's report, the H1N1 pandemic, how Ontario fared. There were a number of key problems with the rollout of the H1N1 response to last fall's outbreak. I mentioned already that international and national handling of that outbreak was generally acknowledged to be well managed. Ontario was lucky that emergency rooms did not see a larger surge of patients. And I think that if you take a look at what is in this bill, and more particularly if you take a look at what is not in this bill, the issue would be, in the event of something happening of the magnitude and scope that was envisioned for H1N1 at the time, and that we're trying to address in this new bill as we go forward, what would have happened in emergency rooms, and still today, even upon passage of this bill, what would happen in emergency rooms remains a concern. Because I don't think, and I don't think most of the experts that I've spoken to, believe that we would have necessarily been adequately equipped to handle what could have been an unbelievable volume of very sick people in a minimum number of facilities. So while we were trying to address the issue of inoculation, and while this bill still looks at the ability to inoculate because it looks at venues and it looks at delivery and administration, it doesn't talk to what would happen in the event that we have a lot of very ill people trying to seek access at emergency rooms that are ill-equipped to handle. Dr. King, the Chief Medical Officer of Health, noted that if ERs experienced a larger surge, we would be dealing with a very different reality right now. And since this bill, and let's deal with it on its terms, seeks redress for deficiencies that were discovered by way of Dr. King's report in how we handled the incipient pandemic back in the fall of 2009, may I go on the record and say we should be looking at expansion beyond the scope of this bill to say, here's what would happen if that pandemic eventuality had come to pass and we had to deal with emergency rooms that were incapable of handling this load. Dr. King, we understand that the bill addresses the disparities between the Chief Medical Officer of Health and local medical officers of health in communicating during an outbreak. There are advantages in this kind of a situation to having centralized control. The Chief Medical Officer and the Minister would be better able to direct resources where necessary. So we understand that, but I still say that the resources we're talking about are resources that are largely involved in prevention and that don't at this point address treatment, dare I say cure. So careful management of resources can be monitored and distributed appropriately at a centralized location. One of the reasons we're supporting this bill is we agree with that. But we would like to see some of the cracks in this bill filled in so that we look at not just the eventuality, but the reality of a pandemic situation. Let's talk for a moment about Panorama. Panorama would inherently ease the distribution and rollout of vaccines during such crises. Government has dragged its feet on the implementation of this very important and vital program. Ontario will continue to take steps toward implementing Panorama, a pan-Canadian initiative which will improve public health surveillance and enhance the province's capacity to deliver immunization programs, improving Ontario's ability to respond to public health emergencies. A document from the Ministry of Health and Long-Term Care, described as a backgrounder, said this on 29 November 2009. So Ontario will continue to take steps toward implementing Panorama. Well, Panorama has been in development for 6 years. 6 years, still not functional. So we have to ask ourselves the question, why? Is this rot in the system? I'm just asking this rhetorically, because 6 years is a very long time to address something that is urgent enough to have elicited a bill barely a year after something didn't materialize that could have materialized, and Panorama seeks to address that on a far wider basis than just the province of Ontario. So I have to ask myself if there's some rot in the system, maybe e-health style rot. Just saying. Dr. Pellizzari, local medical officer of health in Peterborough, noted, and I quote, that we are not collecting local data right now. She continued to explain that there are currently gaps in the health unit surveillance. Continuing to quote, health unit is looking at doing more with less. And that's from Kawartha Region by Lauren Gilchrist, February 10th edition. So health unit is looking at doing more with less. If we're going to deal with resources, let's not look at resources being insufficient to do what it is you have to do. And that is a local medical officer of health in Peterborough who is saying that, not me. Panorama would help cast that health surveillance net that many health units, such as this one, are seeking. Government backtracking and ignoring the advice of experts is something that we see all too often in the province of Ontario, and I raise the question, because it has to be raised, as to whether or not this is happening here. So we're left with having to deal with a patchwork in order to create a fully integrated health protection and promotion system. And what we're seeing in this bill is something worth supporting on our side. I've said we would support it because on a standalone basis it works. But on an integrated basis, as part of our system used to address an eventuality like H1N1 or some other hideous, I could go as far as to use the word plague, coming our way, we're not there. That's what the experts are saying. We're not there. We quote again from Dr. King, who says in her report, it is essential that we extend our chain of command to the local level. So there's this mismatch, this disconnect. You've got a local medical officer of health in Peterborough saying we don't have enough resources, and you've got a report from the chief medical officer of health saying we have to connect by a chain of command that addresses the local level. Let me turn to York Region, Southern York Region, which is of maximum concern to me. In York Region, where we are gravely underserviced in our health unit requirements, the centralization of pandemic and outbreak surveillance and management would greatly have alleviated the pressures faced by the Central Lynn and York Central Hospital. We don't have sufficient health coverage in York Region at this point. The government knows this. We're sitting in abeyance on a new hospital for the southern part of York Region to the west, which would be co-operated by York Central Hospital. That hospital, known as the Vaughan Hospital, but it awaits approval by that government. So we're talking about resources like that, and we're also talking about the fact that the Central Lynn is constrained from spending in York Region because allocation of resources to York Region have not matched the growth of York Region, as is the case outside of 416 in a lot of areas. The average spending on health care outside of York Region, and let's be specific, in the 416 is somewhere above $900 per year per capita, whereas as soon as you cross Steeles Avenue, you're into about a $200 chop, 700 and change in York Region. That funding formula has to be revisited. That also addresses the issue of resources in York Region. Healthcare is a top issue affecting York Region in terms of access to both practitioners and health services locally. Recent studies have found that healthcare services in the 905 area are currently lacking as compared to the Greater Toronto area, and many residents, particularly in rural areas, may be greatly underserved with respect to physical and mental health services, and that was taken from York Region's, York University's strategic advantage, commenting on health delivery services in York Region in an article that's quite old now, so you'd think it would have been addressed, 2007, November. York Region clinics saw over 1,290 patients receive the vaccine every single day. However, because of the lack of coordination, these clinics were over-capacitated and forced to turn away potentially infected patients. And I'm quoting, York Region H1N1 flu immunization clinics at full capacity. And that's from the york.ca H1N1 in the fall of 2009. So that's York Region commenting on itself. It could only do what it could do. So centralized chain of command, great idea. That's what this bill is about. Adequate resources, also a great idea. That's not what this bill is about, and that's what's lacking, sadly lacking. So in terms of overall support on the part of this side of the House, I'm pleased to stand today in support of Bill 141, but I want to point out that while it deserves the support of all, it is only a piece of a puzzle that has to be established, only a piece of a puzzle that has to be established, and it is a barn door piece of legislation. We're closing the barn door after the horse has bolted. Okay, I think we all, on all sides of this House, know that, and I think what's also important is that if we know that, we don't want to be caught flat-footed somewhere down the road where we actually have a pandemic materialize and we have to ask questions later. God help us with some large number of people very ill or even dying. This could happen, and this is what we're trying to avert. The government has not kept its promise in several areas that affect the healthcare system. This side of the House understands what our healthcare professionals need. The Liberal government continues to waste hard-earned tax dollars that could be going to the front lines of our healthcare system. And rather than pointing fingers at us, we're not in power at this point. We certainly expect to be by the end of the year. You people are in power. Take a look at yourself. Don't point your finger unless your hands are clean. The bottom line is you have to put as much into frontline health care as you can. Tim Hudak and a progressive conservative government will see to it that every single dollar of health care money goes to frontline health care. That's what we have to do. That's what you have to do. Okay, I hope that, Speaker, we can move quickly past this legislation, get on with it, and expand it to the point where it addresses what has to be addressed for the good of all Ontarians. Thank you very much.
Thank you. Comments and questions? The member for Guelph.